Minister of Health, Dr. Frank Anthony, while providing the nation on the local COVID-19 situation on Monday, reported that his ministry continues to see a decline in positive cases. 31,329 cases have been recorded so far for this year, the majority of which were seen in January.
In January, we had our highest amount of cases, where we had 19,900 cases. By February, that came down to 2,570 cases, and March it was 379.
A total of 267 cases were recorded in April, while there was an increase to 1,688 cases in May. 2,750 new infections were recorded in June of this year.
And then it started dropping again. So we saw in July 2,456 cases. In August, that went down to 1,032 cases.
Further providing a breakdown of the total number of cases recorded so far for 2022, the subject minister noted that 287 COVID-19 cases were reported in September. As of October 17, 37 new infections were on record for the month. 2 persons are currently hospitalized. Minister Anthony underscored that while the active number of cases stands at 47, it is an underestimated figure.
Well, there are still people who are infected with COVID. And while we have been tracking 47 cases, this is probably an underestimation because there are lots of people who might have flu-like symptoms, which are now the typical symptoms that one would get when you get COVID.
Since March 2020, Guyana has recorded a total of 71,404 positive COVID-19 cases, with 1,281 deaths and over 70,000 recoveries. On the topic of local vaccination, over 347,000 adults have been fully vaccinated and 26,000 adolescents doubly vaxxed with the Pfizer-BioNTech vaccines, while for the pediatric vaccines, over 8,000 children have accessed a first jab and over 4,000 fully vaccinated. Reporting for the HB 90 News, Joel Vogt.